Constipation is a problem with passing stool. Constipation generally means having fewer than 3 stools a week or having a difficult time passing stool. Constipation is fairly common. A lack of dietary fiber, fluids, and exercise can cause constipation. But other medical conditions or certain medicines can be the cause. Constipation is usually treated with changes in diet and exercise or with non-prescription medicines. Constipation may require medicines, changes in medicines, or other treatment prescribed by a healthcare professional. Long-term constipation, also called chronic constipation, may require treating another disease or condition that can cause or worsen constipation. Symptoms of constipation include fewer than 3 stools a week, hard, dry, and lumpy stools, straining or pain when passing stools, a feeling that not all stool has passed, a feeling that the rectum is blocked, the need to use a finger to pass stool. Chronic constipation is having 2 or more of these symptoms for 3 months or longer. When to see a doctor. Make an appointment with your healthcare professional if you have constipation with any of the following conditions. Symptoms that last longer than 3 weeks. Symptoms that make it difficult to do everyday activities. Bleeding from your rectum or blood in toilet tissue. Blood in your stools or black stools. Other unusual changes in the shape or color of stools. Stomach pain that doesn't stop. And weight loss without trying. Now the causes. Patterns of bowel movement vary from one person to another. The typical range is 3 times a day to 3 times a week, so it's important to know what is typical for you. In general, constipation occurs when your stool moves too slowly through the large intestine, also called the colon. If the stool moves slowly, the body absorbs too much water from the stool. The stool can become hard, dry, and difficult to pass. Lifestyle causes. Slow stool movement may happen when a person does not drink enough water or any other fluid, eat enough dietary fiber, exercise regularly, and use the toilet when there's an urge to pass stool. Medicines. Constipation may be a side effect of some medicines, particularly opioid pain relievers. Other medicines that cause constipation include some that treat the following conditions: pain, high blood pressure, seizures, depression, disorders of the nervous system, and allergies. Problems with pelvic floor muscles. The muscles that hold up organs at the bottom of the torso, also called pelvic floor muscles. The ability both to relax the muscles and to bear down are necessary to pass stools from the rectum. Problems with weakness or coordination of these muscles can cause chronic constipation. Blockages in the colon or rectum. Damage or changes to tissue on the colon or rectum can block the passage of stool. Also, tumors in the colon, rectum, or nearby tissues can cause a blockage. Other factors. A number of conditions that affect the work of muscles, nerves, or hormones involved in passing stool. Chronic constipation may be linked to a number of things, including irritable bowel syndrome, diabetes, multiple sclerosis, nerve dysfunction or damage, overactive thyroid, also called hyperthyroidism, Parkinson's disease, and pregnancy. Sometimes the cause of chronic constipation can be found. Now, the risk factors. Factors that may increase your risk of chronic constipation include being an older adult, being a woman, getting little or no physical activity, and having a mental health condition such as depression or an eating disorder. Complications. Complications of chronic constipation include swollen tissues around the anus, also called hemorrhoids, torn tissues of the anus called anal fissures, hard stools backed up in the colon, also called fecal impaction, and exposed tissue of the rectum that has slipped out of the anal opening, also called rectal prolapse. Now, to the most important part of this presentation, the prevention. The following tips can help you avoid developing constipation. 1. Eat lots of high fiber foods, including vegetables, fruits, beans, and whole grain foods. 2. Eat fewer foods with low amount of fiber, such as processed foods, dairy, and meats. 3. Drink plenty of fluids. 4. Stay active and exercise regularly. 5. Don't ignore the urge to pass stool. And lastly, create a regular schedule for passing stool, especially after a meal. Thank you very much for sticking with me to the end of this video. Kindly subscribe to my channel if you find my videos informative. Don't forget to share to your family and friends as well. Till we meet again, take a very good care of yourself. Remember, you can also make a difference. And don't forget, Kofi loves you. Peace out.